Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. Today, I am going to present a very interesting research project done by Dr. Vijay Pathak, Dr. Arun Mahapatra, and Dr. Rajgopala Sri Krishna from the Ayurveda Institute, New Delhi. And this research work is so fantastic that everybody who is going to listen this video till end, they will be get definitely benefited by this information, because the research is a very common society problem by which the parents are always get frustrated. The case of autism. Try to understand, the research is related with the autism. Autism spectrum disorder, ASD, is a neurodevelopmental disorder which is marked by impairment with social interaction and the presence of repetitive and restrictive pattern of behavior. Genetic and environmental factors that affect the developing brain influence it. Even though there is not a single overreaching etiology for autism, yes, continued research is expected to be done in the cases of autism spectrum disorder, ASD. In addition, there are different problems like attention deficit hyperactive disorder. I have already made the video on this ADHD, but today we are going to talk about autism. Autism can be categorized under the Unmad and can be related to Kapha Vataj Unmad, because most of the signs are almost similar to Kapha and Vata type. For example, prefer to live in only one place, prefers alone time, do not like to socialize, prefer not to speak or communicate, motor mannerisms, frequent self stimulating emotions, and imitation or repetition of the sounds or the words. The incidence of autism in India is also increasing day by day. Now, in this particular research, the patient was of 5-year-old male patient. He came to the OPD of pediatrics, Ayurvedic pediatrics, and having the complaints of poor eye contact, no communication and social skills, poor speech, repetitive hand movement, and solitary play activities, hyperactivity, sleep disturbances, and constipated bowel. Antenatal history. Mother's age at the time of birth was 30 years and had a history of abortion at 2 months of gestation. Mother was suffering from interstitial lung disease and arthritis at the time of pregnancy and taking medication for the same. Birth history. Normal, full term vaginal delivery at the hospital. The baby cried immediately after birth with no history of fetal distress, and birth weight was 2.75 kg. Now, we will try to see actually what type of the treatment was given to this autism child. Number 1, Deepana Pachana and Mrudu Virechana. For example, Chitrakadi Vati 250 mg twice a day before food for 3 days. Abhayarisht 10 ml plus 10 ml water after food at night for 3 days. Then internal medication includes Saraswat Ghrita 2 ml twice a day with milk after meal for 2 months. Ashwagandharist 5 ml twice a day with equal water after food for 2 months. Guduchi Churna 1 gram twice a day with honey, oral application before food for 2 months. Madhuyashtyadi Churna 1 gram with the same like before food and for 2 months. Vacha Churna 500 milligram, all mixing together and given with honey. Then Panchakarma procedures. Number 1, patient was advised to do at home Kshira Bala Taila Abhyanga every day for 15 minutes morning for 1 month. Then Saraswata Ghrita Pratimarsha Nasya 0.2 ml each nostril once in a day around 7 to 8 am, that is early in the morning. Then the child was brought in the Panchakarma unit and he was given Kshira Bala Taila Abhyanga once in a day morning for 7 days. Saraswata Ghrita Nasya 0.8 ml each nostril also for 7 days. Then again at home the patient was continued with Kshirabala Taila Abhyanga and Saraswata Ghrita Pratimarshanasya 0.2 ml. Now let us start to discuss how that particular treatment is planned. Chitrakadivati was given for Deepana Pachana and Abhayarishta was given for Mrudu Virechana before starting the main medication and procedure because the child was complaining of reduced appetite and constipation, by which the appetite was improved and constipation was relieved. There was no adverse effect observed. Saraswata Ghrita is mentioned in Ashtanga Hridaya, is said to be improving speech, intellect, memory, and digestive factors. Ashwagandharist is mentioned in Vaishajya Ratnavali, and one of the indication is Unmad. Guduchi and Madhuyashti are mentioned by Acharya Charaka as Medhya Rasayana, that is intellect enhancer, and Vacha Churna was prescribed for Vak Shuddhi, that is speech enhancer, by Acharya Vagbhata. Considering the dominance of Vata dosha in this condition, Kshirabala Tail, which is mentioned in Sahasra Yoga in Vata Vyadhi, was used for Abhyanga or massage to calm Vata dosha. The dose of Nasya was calculated using the child's index finger, where the researcher soaked the finger into the Sneha, that is Saraswata Ghrita, and measured the total quantity that dribbled down in a measuring container, which came around 0.2 ml, which was taken as 1 bindu. Okay, now after that, let us understand ISAA grading score. ISAA, it is related with autism. If it is below 70, then that is normal. If ISAA scale is in between 70 to 106, that is under mild autism. 107 to 153, that is under moderate autism. Then, if it is greater than 153, that is severe autism. The ISAA score before treatment for this particular child was 113, that is, moderate autism was there. After treatment, it came down to 84, that is, mild autism. ISAA measurement or assessment scale is divided into 6 domains. Number 1, social relationship and reciprocity. Number 2, emotional responsiveness. Number 3, speech language. Number 4, communication, behavior pattern, then sensory aspects and cognitive component. Okay, now we will try to conclude this particular information regarding the autism research. But before that, let us understand where actually the improvement was seen. For example, bedtime assistance, that was improved that after your research treatment. Sleep onset delay was also improved. Sleep duration was improved. Then night wakings were less. Then parasomnias, a little bit, not much of difference. Sleep disordered breathing, it was also not much improved, but daytime sleepiness was improved. The most important is autism parenting stress index was remarkably improved. In short, what we can understand with this autism research is as follows. Try to understand the conclusion of this research. Autism spectrum disorder (ASD) is a group of neurodevelopmental disorder marked by impairment in varying degree of social communication and interaction, repetitive behaviors, and restricted interest. Based on clinical characteristics, ASD, autism spectrum disorder, can be correlated with Unmad mentioned in Ayurvedic classics. In the present case report, 5-year-old male patient who was presented with poor eye contact, no communication, no social skill, poor speech, repetitive play activity, hyperactivity, constipation, and sleep disturbances. It was diagnosed at ASD was established using the Indian Scale for Assessment of Autism. I repeat the word Indian Scale for Assessment of Autism, that is ISAA. ISAA, Indian Scale for Assessment of Autism. Test was done. Abhyang and with Ksheerabala Tail and Nasya with Saraswat Ghrita, along with internal medications like Saraswat Ghrita, Ashwagandha Rishta, Guduchi Churna, Madhuyashti Churna, and Vacha Churna were given. Remarkable improvement was noted in overall ISAA, that is Indian Scale for Assessment of Autism. That score as well as clinical improvement noted in poor eye contact, hyperactivity, and peer relationship. Child sleep habit questionnaire was used to assess the child's sleep pattern and improvement was noted. The stress level of the parent also decreased, which was assessed using Autism Parenting Stress Index. No adverse effects were reported during the treatment period and also during the follow-up. My dear students, my dear researcher, my dear friends, I hope this type of Ayurvedic research information will be definitely improve your faith on Ayurveda and you will take your child of autism to the nearby Ayurvedic hospital or nearby Ayurvedic physician. My dear friends, if anybody of you any health or mental complaints, Ayurveda Academy has an expert team of doctors. We do the paid online consultation. You can definitely WhatsApp on 9226 at 10630. My dear friends, to hear such a interesting researches of Ayurveda, please don't forget to like this video, share this video and subscribe my YouTube channel. Also one good news that in each now video you will get the subtitles in another language or in the same language. So you can understand the concept very well. Thank you very much. I wish all the best. Take care and see you in the next video. Thank you.